I'd like to introduce Dr. Bonni Goldstein. She is the Medical Director for Canna Centers, and today we're going to be talking about cannabis treatment for autism. Thank you so much, Bonni, for being here.
No problem.
Well, before we get started, I wanted to know, what is your background and how did you end up as the Medical Director overseeing clinics devoted to cannabis?
Well, I trained in pediatrics at Children's Hospital Los Angeles, and I went into right out of residency after being chief resident. I worked as an emergency transport physician for Children's Hospital for a few years, which was basically picking up sick children at outlying hospitals and bringing them back to tertiary care hospitals. So I worked with a lot of very sick children. And then after that, I worked as a pediatric emergency medicine doctor for about 12 years or so at USC LA County Medical Center, which was quite the experience. And as you can imagine, I worked crazy hours. And then I had a child myself. And around 2008, I was a little burned out. And I took a little time off. And at that time, a friend of mine became ill. And she was at a point where traditional kind of conventional medicine wasn't really helping her. And she asked me about medical cannabis. And I was like, I was ignorant about it. You know, in medical school, they teach you cannabis is a drug of abuse. I certainly wasn't prescribing it at the time to children or really even knew about its medical value. But since I had taken a leave of absence, and I'm a science geek, I decided to do some research for her. And it astounded me. I was amazed by the research and the scientific evidence that existed in scientific literature. And so rather than going back to the crazy hours as, working it all night as a mom and then, sleeping all day, I decided to just work part-time in a medical cannabis doctor's office here locally in Los Angeles. And after a few months of talking to patients, seeing how medical cannabis worked, and of course, in my friend, she got tremendous results, I realized that I had kind of found another passion and I needed to do this type of care full time.
Now, I'm listening going, my goodness, there's so much, misunderstanding regarding all of this. So when you're talking about this, what medical conditions do you treat in adults and children with this?
So I do see both adults and children despite my background as a pediatrician. The majority of adults that are coming into my office are suffering chronic symptoms from, all kinds of diseases. But really, when you boil down to it, the common thread is chronic pain, sleep issues, anxiety, depression, issues related to epilepsy, cancer. Many of the pain conditions are arthritis, migraines, post-surgical or like post-traumatic pain after a fracture, something like that, or a car accident. Chronic back and neck pain, and also a lot of patients are really suffering with inflammatory conditions such as autoimmune conditions. I see patients with multiple sclerosis and cancer. A lot of patients with colitis, irritable bowel syndrome come to my office, fibromyalgia, a number of patients with bipolar disorder. And in children, it's really a much narrower diagnoses that I see: intractable epilepsy, children with autism, cancer patients, and then a small percentage of patients that have severe psychiatric disorders in the pediatric population. Interestingly, most of the patients that do come in, whether adult or children, are suffering for many, many years before they see cannabis as a possibility. And usually it's because somebody mentioned it to them, or they're desperate and they're online reading about it, and that's how they end up in my office. Unfortunately, most patients are not referred by their physicians or specialists, although that is becoming more common as more doctors are starting to become aware of cannabis as a legitimate medicine.
Now, there's been a tremendous amount of media attention around medical cannabis. Can you explain the recent interest in cannabis as medicine?
Well, it's interesting because, cannabis has been medicine for thousands of years. And if you look into the history of it, which is fascinating and has been written up online and certainly in a lot of books related to this topic, it was medicine until really the 1930s, late 1930s, early 1940s, when laws were implemented to outlaw hemp and cannabis. So it was always used as medicine, even though people at the time didn't understand how it worked as medicine. And so in the 1960s in Israel, researchers discovered that THC was the psychoactive ingredient, so to speak, for cannabis. And then remember in the 1970s, the Controlled Substance Act was implemented, which virtually outlawed cannabis as it became a Scheduled I controlled substance. So really, we lost a lot of years in there, other than the part where, people were just kind of using it recreationally. But in the late 80s, what's interesting is that a researcher discovered that we have sites in our brain called receptors. And we have receptors for all kinds of things. We have opioid receptors. That's where opiates work. We have serotonin receptors. That's where serotonin works, and so on. And a receptor is like a lock, and it's waiting for its chemical key to come along and trigger it. And so in trying to figure out just exactly how THC caused the effects that were well known to man, the researchers found these receptors where THC interacts. And they called these receptors cannabinoid receptors. And they basically then went deeper into the research and found this system that exists in all of us called the endocannabinoid system. And it really opened up a huge area of research because here's this new receptor that scientists can study. And if you think about it, it wasn't that long ago. It was late 80s, early 90s. So, just about 25 years ago or so. And in the research, they discovered that the endocannabinoid system is involved in just about every physiological process in our brains and bodies. And the reason we have it, the goal of this system, is to maintain balance of the cells in the face of environmental insult. So we're constantly exposed to things in our life. We have illness and inflammation and triggers and so on. And the endocannabinoid system is supposed to kind of be protective and to help the cells maintain balance. Since all of this research has been done, scientists have found that certain medical illnesses are associated with an actual dysfunction within the endocannabinoid system. For instance, migraines are thought to be part of that, fibromyalgia, irritable bowel syndrome, schizophrenia, anxiety. And as research continues, we're discovering that this imbalance in the endocannabinoid system may be the root cause of a number of illnesses. And it turns out we make our own cannabis-like compounds that are released by cells in response to these insults that I mentioned, like injury, inflammation, or illness. And our bodies release these compounds very similar. If you eat a candy bar with high sugar, your body releases insulin in response, right? Your body releases hormones in response to the triggers to start puberty. Well, your body releases these marijuana or cannabis-like compounds in response to an insult with the goal of trying to balance you back from the insult. And when you use cannabis, you're targeting this endocannabinoid system with the goal of kind of helping your brain and body get back into balance. So the compounds that are in the cannabis plant the body recognizes as natural because you already make them. We already have a system by which our body uses them and breaks them down.
Well, as I'm listening to everything that you're saying, I'm just thinking it pretty much can help just almost everything that people are dealing with, for a good portion of almost everything people are dealing with. And it's just crazy that, we're not talking more about this. And when you're thinking about the cannabis plant, you're talking about it as a medicine. And yet, out there, I think, again, as I said earlier, there's so much, misunderstanding about this. So when we talk about, what is the cannabis plant that makes it a medicine and how does it work?
For lots of different, or cannabis as medicine is used for many diseases. And so people say, well, how can that be? So again, you have this receptor in the brain. And so the receptor is really there for the chemicals that you make in your body. okay? But it turns out that the cannabis plant obviously exists in nature, and it contains over 400 compounds. And there's a family of compounds within the plant, about 100 of the 400 compounds, that look alike and act alike, and they're called cannabinoids. And specifically, they're called phytocannabinoids. It's P-H-Y-T-O. Phyto refers to plant-derived, because remember, we make cannabis-like compounds that are also called cannabinoids, but when we make them within our own body, they're called endocannabinoids, E-N-D-O, like endorphins, endocannabinoids. So from the plant, THC is the most well-known cannabinoid, and everybody's kind of heard of THC at this point. And because it is known to be the psychoactive ingredient in cannabis. Remember, if there's over 400 compounds and one compound is psychoactive, all these other compounds are not. It's quite interesting that the plant's been vilified for this one compound. But THC works by binding to the receptor that I mentioned that the scientists found within the endocannabinoid system. And basically it works to mimic the natural endocannabinoids that we make, our own inner cannabis, so to speak. And by taking THC, you're triggering this receptor system that's to start, quote, the balancing, meaning if you're patients who come to see me who say they have out of control immune system, we know these receptors exist in the immune system. By using THC, they're targeting those receptors to balance part of the immune system that may be out of balance. There's another compound in cannabis called cannabidiol. Its acronym is CBD, and it's had a lot of media attention lately. What's interesting is CBD was also identified in the 1960s, but because it didn't have the psychoactive effect, at the time scientists were looking to see what caused psychoactivity, and when they found that CBD did not, it was kind of ignored. But over the last couple of decades, there's been a huge amount of research on CBD, and it turns out it's a very medicinal compound. It works in and around the endocannabinoid system, not at the receptor site, but it interacts at multiple areas to help stabilize and protect cells from damage during disease state. Cannabidiol is a very protective compound, and it also helps with epilepsy, it helps with anxiety, depression, pain. It can be helpful for people who have immune disease because it's a very, very potent anti-inflammatory. Now, apart from these two cannabinoids, the other cannabinoids, which there's many of, we call those minor cannabinoids, and they all work together within the system, our system, and we call that the entourage effect, which refers to the fact that all of these compounds work better when they are together as opposed to an isolated one compound product that are similar to pharmaceuticals. So when you're taking cannabis, you're taking a whole bunch of different molecules, compounds together. Another group of compounds in the plant are called terpenoids. Terpenoids are interesting because they exist in all other plants as well. Cannabinoids are basically what I call species-specific for cannabis. So THC and CBD occur specifically in the cannabis plant, but terpenoids, which are the essential oils, occur in many other plants. There's one particular terpenoid called myrcene. Myrcene occurs in hops and rosemary and mangoes, as well as cannabis. And myrcene is responsible for some of the sedating effects of cannabis. There's another compound, terpenoid in cannabis called linalool. Linalool is cross-species with lavender. And we know lavender is very calming and anti-anxiety, and we know that strains of cannabis that are high in linalool also have anti-anxiety properties. And so it's not just the cannabinoids, but it's also the terpenoids. And a fair amount of research has been done on the synergy between cannabinoids and terpenoids to show that they can enhance each other's effects. And that's why, for many people, cannabis works so well. It's because you're not just taking one compound, you're taking a multitude of compounds that are working each other together synergistically to enhance the effect.
Now, you're talking about endocannabinoid system, right? What exactly is that?
Okay, so when I refer to the system itself, as I mentioned, it consists of the receptor that I talked about. So a receptor is like a lock, and if you can imagine a round cell, like think about like back to, high school biology, and you learn, here's a cell and here's a nucleus. So right on the cell wall sits this funny little structure called cannabinoid receptor. And what's happening is that, cells talk to each other by sending each other messages. And in the brain, those messages travel by what we call neurotransmitters. Those are the chemical messages. So if a chemical message is off, what happens is the cell that's receiving the message may see that the message is off, meaning let's say like for epilepsy, the brain is firing and sending too much neurotransmitter. It's overexcited and it's sending that overfiring message, which can eventually lead to a seizure. The cell that's receiving those neurotransmitters can note that there's too much neurotransmitter headed its way, which triggers that cell to make the natural cannabis-like compound called an endocannabinoid, which then goes back up to the receptor on the cell that's sending the message, saying, hey, turn it down. I always joke around that it's like my teenage son in his bedroom. He's locked the door and he's blaring on his guitar, right? It's just so loud, the whole house is shaking. If I knock on the door, he can't hear me. It's too loud. But if I have the key that I can put in his door and open his door and say, hey, turn it down, right? He can hear me and he can turn down the guitar. Well, it's very similar in that the cells talking to each other. It's a signaling system. It's one cell telling another cell, hey, turn it down, by using this lock and key mechanism. And so when we talk about the endocannabinoid system, we're talking about the natural cannabis-like compound that you make, finding that lock, triggering that lock, basically, putting the key in the lock and sending the message to the cell. Another part of this, too, though, is that we make enzymes in our bodies and brains that will go and break down the inner cannabis. So it's just not hanging around all the time. Your body makes it to send the message, and then an enzyme comes along and breaks it down. So that's kind of the totality of the endocannabinoid system in a very simplistic way. Further research that's going on now, there's a huge amount of research in this area, is showing that it's really very complex. But understanding that kind of helps people understand that, the cells can talk to each other and there is a feedback loop. When I was in medical school, I learned that cells only talk to each other in a one-way street. One cell talks to another and there is no feedback. But it turns out there is this feedback. Here's an example. So if somebody has nausea, let's say from chemotherapy, and the medication that they've been given isn't working. If they use cannabis medicine and let's just say taking some THC, when they take the THC into their system, whether they inhale it or take it as drops under the tongue, it travels to these receptors, binds to the receptor on the cell that controls nausea, because we know that those cells, particularly in the brain, carry the receptor. And it basically tells the cell to turn down the message of nausea. And I have many, many patients who are on chemotherapy who use cannabis specifically for that reason. And, it works on the cells in the brain to trigger appetite. It works on the cells in the brain to turn down anxiety, to help with pain. And so depending where these receptors are, where your endocannabinoid system exists, kind of determines the effects of cannabis. And so we know that the areas in the brain where the receptors are located include these areas of, for appetite, emotions, motor coordination, stress, memory, learning, as I mentioned, nausea, vomiting, but also pleasure and reward. That's why a lot of people like the effects of cannabis. In the body, their receptors are primarily located throughout the immune system. So when we talk about the endocannabinoid system, we're kind of talking about this one particular system that is trying to maintain balance in certain parts of the brain and body, which includes all these places that I mentioned, plus the immune system as well.
So it sounds as though with the immune system and all the different things you listed that this could potentially help with, it sounds as though the body is depleted or not making enough of it itself. And so by supplementing it with cannabis, it seems as though it's kind of kickstarting the immune system again. Would I be accurate in that?
Yes, and actually I'm going to talk about the endocannabinoid deficiency syndrome. So we do think that, and now we have proof, but this was floated, the first idea of this was really not very long ago. In 2003, Dr. Ethan Russo, who's a neurologist and a medical cannabis expert and researcher, floated the idea that the same way someone can have a thyroid deficiency, right, which is hypothyroidism, or you can have low levels of certain chemicals in the brain that cause certain diseases, you can have a clinical endocannabinoid deficiency, which may explain why so many people find cannabis to work. So, for instance, there's some evidence to show that people with migraines, fibromyalgia, and irritable bowel syndrome, that's kind of the classic triad, those particular patients do very well with cannabis. Now, when you take cannabis, what are you targeting? Well, you're targeting the endocannabinoid system. It doesn't work anyplace else. That's where it works. So when you have a patient who comes in and says, boy, I have profound results, I almost feel like my disease is, quote, cured, all you've done is replace their natural endocannabinoid with the natural phytocannabinoid from the plant, and they have found balance. And so, I do liken it to people who have low thyroid levels, and their doctor gives them thyroid pills to replace. And right now, we really don't have a, quote, pharmaceutical cannabis. There is pharmaceutical THC, but going back to that idea of the entourage effect, just a single molecule or single compound THC does not appear to work nearly as well as whole plant cannabis. And again, because when you're taking whole plant, it's very balanced in the way that the compounds work together. What's interesting is that one of my patients, I gave a lecture recently to a group of patients, and one of the people in the audience raised his hand and he said, it sounds like humans are hardwired for the compounds in this plant, and that's a great way to describe it. And I'm not saying that it's for everybody, but for people who have certain medical conditions, it seems to really work well. For, when you're looking at it in relation to autism, there is some early research, and again, there has not been a huge amount of research, but there's some early studies that are showing a link between the features of autism and dysfunction within the endocannabinoid system. And there's a very good article in I think it's May 2013 medical journal called Neuron that reviews this evidence and linking, basically reporting this problems between the endocannabinoid system signaling correctly to send the message of maintaining balance in models of autism. And so there's not been enough research for sure. Now, there was a case report in the literature where, and this was from Austria, and it was reported in 2010, and there was a 6-year-old boy diagnosed with autism, and he was given a synthetic THC compound, and not very high doses, very low milligram doses. And he was followed for 6 months, and both the parents and a objective observer basically observed him and used rating scales to report what they found. And it's very interesting, and both the parents and the observer reported that the boy had very significant decrease in hyperactivity and in irritability, as well as decreased lethargy. His stereotypic behavior was decreased, and also inappropriate speech was decreased. And he tolerated the treatment well. There weren't really any negative side effects. And wouldn't it be great to have more research so that we could be able to say that this is a treatment for patients, a real treatment for patients, meaning accepted, really, for people who have exhausted pharmaceuticals or behavioral therapy. I do recommend cannabis to many patients with autism, and I tell all the parents, we need more research. And it's really unfortunate that that's not getting done.
Well, you're talking about the system and how it's relating, and, a lot of the families out there, this is still really new to them, and some of them, they just really don't understand why cannabis might work for some people with autism. I know you've gone over some of this, but can you go a little bit into depth of why, specifically for autism, why cannabis works?
Well, so again, it's all related to that dysfunctional endocannabinoid system. So when you're using cannabinoids, it targets that system. And so, for instance, if I hear from a parent that their child who has terrible symptoms is now, with cannabis treatment much improved and able to function, let's say, better therapy. In fact, I got a text message today from a mom who said that just started cannabis a week and a half ago. She had a wonderful ABA therapy interaction today, much better. Even the therapist reported to the mom, hey, something's changed. And again, the therapist didn't know that the child was using cannabis. But when you get that feedback, what the child is taking is very clear. It's basically cannabis medicine. And where does it work? The endocannabinoid system. So if it does improve, it's almost like a test in itself that we're targeting that specific system. And if there is balance now that we're achieving, obviously it appears that there was imbalance there before. And I think I'm being simplistic. I know I'm being simplistic on it, but it's very simple to understand. When my adult patients come in and say, cannabis alleviates my pain, cannabis I don't have the frequency of migraines that I used to have, I'm not giving them magic medicine. I'm giving them a compound that works specifically at the endocannabinoid system. And certainly there's enough research on the endocannabinoid system now to know about the interaction with the cannabis plant. But, when people say to me, why does it work in this person, but it doesn't work in that person? Well, remember, one person may have an endocannabinoid deficiency or dysfunction, and the person who it doesn't work in may not. There is currently no test.
Different.
Right. Everybody's different. Absolutely.
Now, what is your experience in treating adults and children with autism?
Well, most of the patients that present to my office are seeking help specifically because, the parents or caregivers are seeing behaviors that are including severe aggression, self-injurious behaviors or behaviors that are injurious to others. Many of these families are at an impasse. Like the child's no longer allowed to go to school, or, the issues that they're going through are severely impacting the ability for this family to have quality of life. And also, when a child is or a patient is going through therapy, if they're not able to even kind of be present for the therapy, therapy may not work, right? One particular family, crosses my mind. They came to me because their child was basically banned from all of the extended family events because he was so physically aggressive. And it was really hard for the family because they wanted to maintain, obviously these family relationships and support, and they were basically uninvited from everything. And that's just, it creates a very poor quality of life. Most of the patients that I've seen have already been prescribed antipsychotic medications, and, either they've had intolerable side effects or they've not had improvement or both, or parents are very concerned about long-term effects of these medications. And also when patients hit this impasse where they're not able to really, they're not moving forward, let's say, not progressing with therapy, they're not able to kind of have that breakthrough. And again, it's really a poor quality of life for families. Most people don't just kind of get the diagnosis and show up in my office. It's usually after many other modalities are tried. Now, for these patients, I kind of start with, high CBD cannabis. So remember I mentioned THC and CBD. You can get strains of cannabis that are high in one or the other. where you can use a combination approach. And for me, it's a case-by-case treatment. I treat each patient uniquely because they each have a unique endocannabinoid system, and they're each uniquely going to respond differently. But with many of my patients, the parents are reporting calm behavior, better focus, less aggression, better socialization, attempts at communication, improved speech. I've even had teachers and therapists call me to ask about cannabis as medicine for these kids because, they'll see a difference in a child, a significant difference, and they'll say to the parents, what's going on? These are people who are invested in your children, who are working with these kids day in and day out. They know these kids. They know these families. And they'll say, something's changed. This child is different. This child is, doing well, and we're making some real breakthroughs here. And, I remember one specific case where the head of this private school for kids with special needs called me, and she said, okay, you need to explain it to me. I need to understand it because we have a child in the school who's doing incredibly well, and a lot of the other families are going to be looking at this, and I don't know anything. Could you educate me? And I love that because all these educators and people who have invested their lives helping these kids, they want to know about it, just like the parents do.
Well, listening to this and thinking these parents out there are probably wondering, how does a child even take cannabis?
Well, it's so interesting because, I had a family come in and the mother was so upset because the neurologist, and he was an older guy, and he had said to the mom, are you going to just smoke it and blow it in his face? And that's not how kids take cannabis. So most of my patients who are pediatric age and even, teenagers and even some of my adult patients are taking whole plant cannabis medicine in an oil form. So basically what they do is after the medicine is grown and harvested from the plant, it is basically processed naturally into an oil. And usually there's a coconut oil base or an olive oil base. Some people are using MCT oil. So it comes in a bottle as a liquid, and the oil is given either sublingually if the patient can cooperate with that, or it's swallowed. Most of the patients who are treating for autism take 1 to 3 doses per day. The patients, many of my patients who have other diagnoses such as seizures and autism or something else going on may require a different dosing schedule. It really, again, is case by case depending on the patient's particulars. Some patients get a long-lasting effect, and other patients require more frequent dosing. Everybody's metabolism is unique to them. One of the very important things is that a lot of my colleagues in the medical field are of medicine. You're going to get dirty medicine or contaminated medicine. And, right now, although in California, it's still not regulated, and it will be in under 2 years, we're going to have regulations in place. There is plenty of good quality tested medicine available for patients. And, there's this idea that parents are going to go to some, scary cannabis shop and buy whatever untested cannabis. And that's not how I practice medicine. And I teach my patients and the parents, how to identify quality cannabis products and, what products other parents are using. And even parents share amongst themselves in support groups and whatnot of, which medicines they're using and from which suppliers. So I've been doing this 8 years now, and I just find that the quality of cannabis has improved so much just in the last 3 years because that's what people are demanding.
Now, is there a specific type of cannabis that is used for children?
So what's interesting is that, we have research on adolescents who are chronic heavy cannabis users. These are not sick children. These are, teenagers that are, basically using cannabis recreationally, which I don't recommend. And there's some studies that show it can interfere with IQ and impulsivity and later possibly increase risk of other mental conditions. But you have to remember that these are teenagers who likely do not have endocannabinoid deficiency. Remember, teenagers have vulnerable brains almost similar to a fetus growing, where any chemical interaction can cause problems. But you have to remember that patients who are suffering from significant medical conditions such as epilepsy or autism that's impacting their quality of life, who may be having an endocannabinoid deficiency, are not the same as teenagers who are abusing cannabis. It's not fair to equate those two populations. So, but again, I take the risk of THC in the, with seeing the damage seen in these chronic heavy users, which is subtle, but it's there. I take that into account. And so for most of my patients, I start them on a high CBD cannabis oil to see if that will work. And as we kind of progress through treatment, what I tell patients is you may find that adding a little THC will work better for your child. And so I start with high CBD, and I slowly add in or recommend adding in THC to find the balance that works for that patient. So some patients find that high CBD in relation to the THC works. Other patients find that they need a half and half, basically like a 1-to-1 ratio, and then every ratio in between. I have a young man I'm taking care of now who's at a 10-to-1 ratio, 10 parts CBD to 1 part THC, doing great. Other patients may not do well at that. And remember, unique endocannabinoid system, unique response to medicine. What we talk about in the cannabis world is like a personalized medicine, or that we customize it to fit the person's needs. So, one of the things we say is one size does not fit everybody, right? It has to be personalized for your particular condition. And, it kind of goes with the diagnosis of autism. We call it autism spectrum disorder because all of these kids are not the same. There's a spectrum of disease, right? A spectrum of condition. So it's the same thing with cannabis, is that, some patients require very low doses once or twice a day. Other patients require higher doses more frequently. And it really is an individual approach, although I do kind of start the treatment the same way so that we can rule in or rule out high CBD versus needing some THC. THC can be very calming and relaxing, and it also promotes sleep, which is required for some patients. But again, it is by case, using both CBD and THC to find the best balance for that particular patient.
Do you ever worry about children getting high with cannabis use?
Well, it's interesting because we do worry about that. I don't want to make some adults will tell you, oh, I felt high. And in fact, I had a patient in my office today, and she took a little too much of a particular cannabis, and she said she felt uncomfortable. And certainly in a child who may not be able to communicate, we don't want to make them uncomfortable. So remember, CBD does not cause psychoactivity, and that's one of the reasons I start treatment with the higher CBD to THC ratio. If someone is suffering with an endocannabinoid deficiency, meaning they're missing, remember, some of their endocannabinoid, their cannabis-like compounds, we're replacing what's missing. And so sometimes taking THC for a patient who's very depleted in their own natural endocannabinoid may not make them high. There are patients who come into my office with severe, let's say, attention deficit disorder or other conditions where they're very endocannabinoid deficient. They will tell me they just don't feel high from THC the same way that somebody who has a balanced endocannabinoid system might feel high. So a dysfunction in the endocannabinoid system is basically can be corrected, well, not 100% by cannabinoid replacement, but at the same time, again, case by case, what I tell patients or parents and caregivers who are giving the medicine, if you see your child uncomfortable, if you see your child with, red eyes or anything that kind of alerts you to the fact that maybe you gave a little bit too much, back off on the dose. Call me and let me know what's going on. It's not something that you have to worry about repeating because remember, when you're using this medicine, you give it and then you have to observe the outcome. And, that's kind of how we treat pediatrics. When your child's sick and you give antibiotics, you can usually tell in a few days because you're watching your child to see if they're getting better. So the only way to know with cannabis treatment for children, especially those children who are unable to communicate or verbalize, you just have to watch. And so if you think that maybe the child is feeling a little bit high, you just back off on the medication. It's not something that I'm worried too much about because we include CBD in the overall treatment. CBD will balance out some of the psychoactivity of THC and help suppress some of that. So we just don't see, I just don't see too many people having that problem.
Now, you addressed this a little bit earlier, but parents and patients may have concerns about the quality of the cannabis. How does one ensure that the medicine is clean and pure?
Well, as I mentioned previously, the products can be tested. Some of the things that they test cannabis products for is potency. So that tells you how potent it is in terms of milligrams or percentage. But they can test it for solvents, pesticides, and bacteria and mold. And remember, it's a plant, so there can be bacteria and mold in it. And, I basically insist that my patients use tested products. There's no reason for anybody to use anything that's untested at this point. Some families do grow their own, small amount of cannabis for their own child or for their own adult patient who needs it. And they're pretty sure because they're growing it of what's going on, with the quality of their plant because they're not putting pesticide, they're not using solvents. But we have to be very careful because at this point in California, there is no requirement for cannabis suppliers to test their medicine. Those regulations are going to be in effect as of January 2018. However, other states that have medical cannabis and some that even have recreational cannabis laws have all instituted testing requirements for any cannabis that's sold to a patient or consumer. And so that is the way to go, is to use tested medicine. Some of my parents have, early on when I was doing this, were still not sure of, which supplier and myself as well, until the suppliers in the area that are good. Some of the parents were actually buying oil and then sending a sample off to get tested at a third-party facility to ensure that they were getting clean medicine. Right now, apart from new suppliers, there are a handful of suppliers that are being used that are very trustworthy.
Now, are there any side effects when cannabis is used for autism?
So that's a great question because, when you read about cannabis, you do worry about side effects. So, one of the things that I see in general is that most of my patients don't really have side effects. That's one of the remarkable things. You worry about it initially because it's in the, if you go online and read about, marijuana is bad and it's this and that. But in general, for medical dosing, I just really don't see a lot of problems. One of the things that I see sometimes with CBD in certain patients is that it can be overstimulating, especially for someone with autism or kind of behavior issues. Interestingly, CBD is a little bit alerting, and so it can also interfere with sleep if it's given right before bedtime. So many patients using CBD will just take it earlier in the evening. In general, THC is calming for most, but occasionally, I have found patients that have the opposite effect where THC can cause agitation or aggressiveness. And, of course, we're not looking for that effect, but it can be related to the strain. And so certain strains can be stimulating. Certain strains of cannabis, I'm talking about THC strains, can be sedating. And so sometimes just changing the strain from a stimulating strain to a more sedating strain can kind of take care of this possible side effect with THC. I talk to thousands of people every year about their cannabis use, and the significant majority do not suffer with side effects. And part of the reason is because they are using it in medical doses. They are not using it recreationally. And remember, the medical dose is to treat the medical condition, and it's the lowest dose to give the desired results. Remember, recreational use is kind of like overuse. And so anytime anybody overuses anything, you're going to end up with some kind of side effect. So I just don't really see that many side effects when the medicine is used, responsibly and for a medical treatment.
Now, what benefits have you seen in your clinical experience in treating children and adults with autism?
Well, so as I mentioned, parents, teachers, therapists, caregivers of these individuals, often report dramatic improvement, including like calmer behavior, less aggression, better communication. Many, I have one mom who sent me a picture of her son sitting in the living room after like maybe 2 days of CBD oil, sitting and reading a book. And in 11 years, she said she had never seen him sit and pay attention to a book. I mean, that's kind of amazing when you hear about that, right?
Amazing.
Yeah. And parents will tell me their child just seems to have more interest in the world around them. They're interested in the people who are around them. They're interested in maybe, toys or objects that are around them, ability to follow directions. And, just in general, a better quality of life, especially for people who were having, aggression or the kids having self-injurious behavior. I mean, nobody wants to see that with their kids. And it can be so disruptive to the family. And so I think the greatest benefit is just the overall quality of life is improved. I don't talk about curing anybody with cannabis. I mean, it's an interesting thing because some patients will say, well, my migraines are gone, so I'm cured. But they're just found an effective treatment, right? That happens to be non-toxic for them. But really what we're talking about with cannabis is just a better quality of life with little to no side effects for most families. And that's something that is priceless.
Absolutely. Especially, I'm a mother of a child with autism, so anything you can find that can work for a child or of any age, I think is absolutely priceless for the best quality of life, as you mentioned. Now, what resources are there for parents who are looking for information about cannabis?
Well, unfortunately, the medical community has not really embraced the use of cannabis for people with autism. There was a recent article that reviewed the scientific evidence, and as I said, this is lacking. There's clinical evidence, and there's a lot of what we call anecdotal reports. In my experience, and I've been a pediatrician now for 25 years, and I've been a medical cannabis physician for 8 out of those 25 years, parents do not lie to me, especially when they're paying for something out of pocket. And cannabis is not cheap, okay? So for many families, they will, say to me, this is working. We can't, this is great. And other families say, it didn't work for us. I still feel like it's an absolute option. The problem is that going to, right now, a specialist or looking in the medical community, apart from a medical cannabis specialist like myself, you're not really going to find that much support. Although I will say that there's has been some recent interest from, I work here in LA, a group of developmental pediatricians approached me about learning more about cannabis, which is great because we need to have doctors who know about this, who can educate families, educate parents, so that you can have the information you need to decide whether or not this is something you want to try. Now, when you look, there's been study after study over the last 50 years looking at the safety of cannabis. So, it is safe, especially when compared to some of the antipsychotic medication side effects. But again, you want to have all the information before you proceed forward with this type of treatment. And so for many families, they're turning to a website called projectcbd.org. Which is a nonprofit that has tremendous amount of information on the website. They do a great job at, you can look up the ailment and you can click on that and it lists all of the scientific evidence. So that's a great website for families. There's a nonprofit called the Center for Complementary and Alternative Treatments in Burbank. And, it's one of the few places where parents can find help for children with autism or epilepsy. It's run by a father of a child with epilepsy and autism. And it's kind of a focus for alternative treatment after, he sought conventional treatment and just, did not find any help for his daughter. And he's found some quality of life improvement with alternative treatments. And so he's kind of set up this center for parents to go and learn. And there's also like a lot of support groups online for parents. And so on Facebook and whatnot, and unfortunately you have to do some kind of the internet search to look for these groups, but there are plenty of resources out there. And again, since the medical community really hasn't embraced it, you do have to look outside the medical community to find, for the most part, the information that you're looking for.
For the place you were talking about that the father set up, for those listening, you were speaking about Burbank, California, correct?
Yes, it's called the Center for Complementary and Alternative Treatments, and it's just recently opened, but I've had a lot of families tell me that they have found some very nice information there. And like I said, too, projectcbd.org has a wonderful website just chock full of information for parents. It's a starting place.
Now, where can people find more out about you? I know that you're very well known in the Southern California area as a doctor that's helping the autism community. How can they find out about you, Dr. Goldstein?
Well, I have a website, and it's Bonni, Bonni, last name Goldstein, Goldstein M.D. .com. And there's some information there. I just revised it, so I'm still putting up information, but there's articles and resources there as well. I do have a 45-minute video on YouTube, and if you just Google Dr. Bonni Goldstein Epilepsy, I have a lecture there that talks all about the endocannabinoid system in depth. And it does focus mostly on epilepsy, but I do talk as well about autism and some other conditions. So it kind of gives you the whole 45-minute or to an hour view on, or I should say lecture on the science of cannabis. And so many people have reported to me that that's been very helpful, especially because there's some slides that are included there to give some visuals.
Well, I just think that listening to you, so many families are going to have so much more information and better understanding and so much help. And I just want to thank you for taking the time to talk with us today.
All right, great. Thank you for having me, Kristen.
Thank you so much.